Hello, my name is Heather Ferguson. I'm the founder and executive director of the Lymphedema Advocacy Group. I'm so glad to be able to share information with you about the work our group has been doing to improve insurance coverage for compression garments and supplies here in the United States. My relationship with lymphedema began with the birth of my twin boys, Devdon and Dylan, in September of 2006. Dylan was born with primary lymphedema. When he was 7 months old, he was prescribed his first set of compression garments. That is when I learned about the lack of insurance coverage for these medical supplies. Many of the things I'm going to speak about are on this graphic, which highlights key aspects of our group's efforts and accomplishments over the last 14 years. If you would like to view this graphic in more detail and be able to utilize the links to additional information, you can access it through our website by scanning the QR code. I will also share the QR code again at the end of the video. In 2010, I founded the Lymphedema Advocacy Group with a mission of closing this gap in coverage. In the United States, we have a national health care plan called Medicare that covers adults age 65 and older and also younger Americans with disabilities. Because the majority of other insurance policies in the United States model their coverage after Medicare, the key to solving this problem was adding compression coverage to the Medicare program. Medicare had been unable to cover lymphedema compression supplies because there was no benefit category for these items, which meant that our Congress would have to pass legislation to create a new benefit category. After meeting with my congressman and explaining to him the problem and how it affected my child, he agreed to help. In 2010, the Lymphedema Treatment Act was introduced into Congress for the first time. That same year, our group began educating lawmakers and their staff in order to raise awareness and support necessary for the bill to eventually be passed into law. We are an all-volunteer grassroots organization, so our continued momentum depended on thousands of patients and caregivers getting involved and raising their collective voices. Our group made it as easy as possible for others to support passage of the bill. Most people had no prior advocacy experience, but we provided tools that made it quick and easy to call, write, and meet with their elected officials. Over the years, over 45,000 email letters to lawmakers were sent through our website. Beginning in our very first year, we also started collecting patient stories through our My Lymphedema Story campaign. These first-hand and often deeply personal accounts were powerful anecdotes that helped lawmakers to understand why it was so important to close this gap in coverage. To date, we have collected over 1,000 stories, and these personal statements are a testament to the importance of patient voices in policymaking. We also provided opportunities for individuals who wanted to get more deeply involved by forming teams in all 50 states and creating an advocacy training committee to partner with our team members to provide in-depth training that would boost their skills, confidence, and effectiveness as advocates. For those able to travel to our nation's capital in Washington, D.C., we organized yearly in-person meetings so that advocates could meet face-to-face with lawmakers and their staff. And when COVID struck, like the rest of the world, we pivoted to online meetings, which enabled even more people to participate. Simultaneous to these activities, we also formed strong relationships with other stakeholder groups who in turn engaged their memberships to advocate for passage of the Lymphedema Treatment Act. These partners were not only strong allies in getting the legislation passed, but also in working to implement the new coverage after the bill was signed into law. Over the course of 14 years, we have produced educational materials aimed at informing not only lawmakers, but also the general public and the medical community. We have distributed over 400,000 pieces of information free of charge and have distributed nearly 100,000 pieces of information during this year alone. All of our educational and awareness materials are also available for free download via our website. One of the most pivotal pieces of information produced by our organization was the commissioning of a cost savings analysis. We identified studies that demonstrated potential savings through reduced complications and hospitalizations, then hired a healthcare analytics firm to translate that into an estimate of the money that could be saved by providing patients with the compression garments they needed to better manage their lymphedema. This analysis projected significant savings, and I cannot emphasize enough the importance of research that quantifies the benefits of improved access to care. Finally, after nearly 13 years, on December 23, 2022, the Lymphedema Treatment Act was passed into law. The new coverage was mandated to begin on January 1, 2024, which meant we had just 1 year to work with government agencies to establish all of the details of the new coverage. Throughout 2023, we engaged our community of advocates, culminating in over 700 public comments on the proposed rules that would dictate the details of the new coverage. The comprehensive coverage established by the final rules demonstrate the strength of our advocacy and, once again, the importance of the patient voice in policymaking. The new coverage provides patients with 3 sets of daytime garments every 6 months and 2 sets of nighttime garments every 2 years. Further, a set is defined as 1 garment for each affected body part, and the rules provide for equitable access to care by ensuring that all parts of the body will receive the same coverage, not just arms and legs, and that the coverage applies to all patients, regardless of the cause of their lymphedema. More work lies ahead, but I am confident that no goal in improving patient care is unattainable if we continue to work together and tackle each challenge with the same resilience and passion that it took to get the Lymphedema Treatment Act passed. Our group's mission will continue to be patient-centered, and we will continue to tackle the obstacles that prevent patients in the United States from receiving timely, high-quality care. I hope this information encourages our colleagues in other countries who are also struggling with insufficient insurance coverage for compression garments and supplies. Once again, you can access this graphic, which links to an abundance of additional information, by scanning the QR code. If you have any questions, please feel free to contact me through the form on our website at lymphedemaadvocacygroup.org. Thank you for the opportunity to share this information and for everything you do to improve the lives of lymphedema patients like my son.